Well, thank you, Donna, for this opportunity to work with these awesome ICU nurses. I really appreciate that you've had me in the unit. And if y'all remember from our last unit conference meeting, we had a large group discussion about some of the critical drips that are used more commonly here in ICU. And this was, of course, more of a refresher exercise for our new nurses that are now out of their internships and they're working here in the unit full time. So today I'll be rounding and discussing some of these drips with you at your patient's bedside. Brandon, did you have a question?
Are you going to be asking about the vasopressors?
No, in particular I'm going to be looking to ask questions more about the TPN or Diprivan, depending on what's hanging in your patient's room. Okay.
If we need to change something out, do we just go ahead and do it or wait for you?
Oh, no, absolutely. First and foremost, take care of your patient. And then we can include that in part of our discussion. Basically, this small group discussion is just a follow-up to our unit conference seminar or the large group discussion we had earlier in the week during our conference time. Okay, any other questions?
No.
Okay, well, let's get started. Okay, John, could you tell us a little bit about what you remember from our in-service? In particular, tell us what you remember about the Diprivan or propofol.
Well, Diprivan is used for sedation, and it has a very fast onset, usually about 30 seconds. We have to be careful because when we set it up on the pump, it has to be on its own pump set. We cannot run it secondary to any other medication. And the other thing, we have to change the tubing every 12 hours because it's highly lipophilic, and it attracts a lot of infection. So we have to be very careful when we connect Diprivan from the bottle and to the patient. The other thing, we have to try at all possible to connect it to a dedicated line to the patient and have hopefully a central line because this is highly sedative. And it will slow. We have to have an airway. Patient needs to be on a ventilator. We cannot give a patient Diprivan as nurses if they're not on a ventilator because it will definitely slow down their respiration. The patient will be unconscious. So we have to have airway. Patient has to be on a ventilator. The other thing, we have to make sure on the pump that we use the pump library. When we use the pump library, it makes sure that we cannot overdose the patient, and so it sets us our minimum and maximum doses. And so when we use the program, we run it as micrograms per kilo per minute, and so we have to know the weight of the patient. And so by using the pump library and making sure that the tubing is changed every 12 hours, that kind of helps us protect the patient and give the appropriate range of doses. Now, the dose of propofol that we get, the doctor has to specify what the dosage is. They'll give us a range, and our range usually we titrate to a sedation scale. And so we use a Ramsey sedation scale or a RAS sedation scale, and that's determined by the physician. And if you don't have that parameters, then we have to call them and have them explain, tell us what exactly they want us to titrate it to.
Very good. Sheila, do you have any questions?
No, Paul explained everything. John explained everything.
He really did. In fact, I'm happy to say you covered all of the objectives from our in-service earlier. So thank you